Good afternoon, everyone. My name is Kimberly Bellamy, and I serve as the Senior Specialist, Strategic Programs and Partnerships here at the Association of American Medical Colleges. Thank you all for joining us today for our conversation on race, health, and resilience with Dr. Wiemi Douoguih. So, as you all know, there are many discussions and conversations going on across the world about race relations. And we thought it would be a missed opportunity if we didn't engage our future doctors, our future dentists, our future nurse, and other aspiring healthcare professionals in this conversation. So we want you to be active participants today. Feel free to chime in with your thoughts and your questions in the chat. And at the end of Dr. Wiemi's presentation, we're going to have a Q&A session so we can go over some of the things that came up for you during his presentation. So now I'm going to introduce our speaker for today. A devoted husband, father, and surgeon, Dr. Douoguih will discuss his experiences in health and perspective on these difficult times and pathway forward. Dr. Douoguih serves as Regional Medical Director of MedStar Sports Medicine. He also serves as the Medical Director and Head Team Physician for the Washington Wizards and Medical Director for the Washington Capitals. He is a consultant for the Baltimore Ravens and NFL Players Association. He served as Medical Director and Head Team Physician for the Washington Nationals for 7 years up through 2015. He has successfully operated on numerous professional and elite athletes in a wide range of sports. Dr. Douoguih is board certified in orthopedic surgery and holds a subspecialty certification in sports medicine. He specializes in arthroscopic treatment of the shoulder, elbow, and knee. He is an award-winning researcher who has published multiple articles in peer-reviewed journals and has lectured internationally on various sports medicine topics. He was an All-American lacrosse player at Washington Lee University, where in 2017 he was inducted into their Athletic Hall of Fame. He also won a national judo championship in 2001. Please welcome our speaker, Dr. Douoguih.
Thanks, Kim, and I'd also like to thank Clarence Fluker and Tony Mancuso for the AAMC for hosting me today. As you know, this is a very difficult and challenging time, but a time that presents tremendous opportunity for us as well. In light of the recent protests honoring Black Americans that have been senselessly killed, the question is, how do we move forward? I've had a lot of people talk to me about the protests, and while protests are a start and they're invigorating, a lot of times these things will die down and we sort of forget about where we started. And we can't forget about the George Floyds, the Breonna Taylors, the Ahmaud Arbery, Freddie Gray before them. It's just really interesting to me how a lot of my white friends and colleagues will come up and say, man, isn't this horrible what's going on? Isn't this terrible? And actually my feeling is a sense of relief, in a sense that finally I see people listening and people coming out. And it's terrible that it took these videos, these self-made videos to bring it out. But whatever it takes, it doesn't really matter. And what I don't want is for this to be lost, because I remember this same feeling in 1992 after the Rodney King beatings and how there were protests on the street and people came out and were speaking. And again, it was very invigorating, but that sort of died down. And 28 years later, here we are again. A lot of the things that have been happening are the same things that have been happening since slavery, since Jim Crow, and it reflects a systemic problem that we have to get rid of and we have to improve upon. So when you think of the areas for reform, you know, people are talking about defunding the police. Well, I'm not a big believer in tectonic shifts, in big changes all of a sudden. I think this is about accountability. This is about making sure that the people that have committed these crimes, whether they're police, whoever, are brought to justice. And so many times we see this where we have evidence right in front of our face that a crime was committed and the people get off. And there's all kinds of excuses made, and we sort of silently endure this. And what's even, I want to say it's a bigger problem, But what we all realize as Black folk is that it doesn't matter how educated you are, it doesn't matter what position in society you have, that I'm sure plenty of you have and will have stories about cops harassing you for nothing. It doesn't matter whether you're a good father, whether you're a good Christian, whether you get good grades in school. All some of these folks see is that you're Black. And so I think we really need to address this accountability, and the proverbial blue wall that everyone talks about, where the cop does something wrong, they close ranks. We need to continue to let our voices be heard, so that we can fight against these crimes and these people can be brought to justice. I remember when I was in medical school, I had a nice brand new car. My parents didn't have to pay for college because I had a scholarship, and so they cobbled up about $13,000, and they bought me a brand new Nissan Altima. Man, I was so proud of that car. I loved it. Now $13,000 is a tax on some of the cars that you buy today. It's amazing how times change. But I remember a snowstorm when I was a medical student, and I'd parked my car on the side of the road, and the snow was piled up so high I couldn't get my car out. So I figured I'd wait till the next day and get my car off the street. Well, I came back the next day, and there was an orange streak and a dent in the side of my brand new car, and I was crushed. I know my parents had worked hard to make that money and get me that car, but I figured it would be covered by insurance. So I called the police. I called the police to report it so that I could report it from my insurance. And I'll never forget it. It was a Black cop and a white cop. The white cop came up and said, "Hey, what's the problem? How can we help you?" And I said, "Sir, if you look there's an orange streak there, and my car was hit last night, presumably by a snowplow, because the snowplows in Richmond had these big orange, they were big and orange." And so he looked at me and he says, "Well, that looks old." And I looked at him in shock and disbelief. I was always taught by my parents to respect authority. I was taught the importance of telling the truth, and the importance of integrity. And I felt instant anger over the response. And I said, "Sir," but I calmly said to him, I said, "Sir, excuse me, but if you can see, there's an orange streak in the snow that connects with my car. And how can that be?" Before I could finish the sentence, the Black cop stepped in and he goes, "Excuse me, are you telling me that my partner's lying?" And he puts his hand on his gun and moves towards me. And I went from anger to I just completely shut down. I almost like went out of my body, and my tone, my demeanor, everything changed. And I just said, "You know what? I must have made a mistake. And maybe that's old." And he says, "Maybe that's old?" He says, "No, but you're going to back up your story. You wasted our time. You called us to come down here. You wasted our time. You wasted my partner's time to tell me about something that you're going to lie about." And he kept coming in, and I kept backing down, sticking to my story. I said, "Listen, sir, hey, there's nothing else to tell you. I must have made a mistake. I thought it was fresh. I don't know what to tell you." And the white cop then stepped in and said, "All right, man, let's go." And they walked away. And so here I was with my car, watching this Black cop who was following along with the white cop who questioned my story. And all I did, I saw my life flash in front of me. I did. I saw it, and I was pretty shaken up. I went to one of my mentors at med school, and a Black man, a mentor of mine, was about 20 years older, and I told him the story. And he said, "Man, that's messed up." And he's like, "It's just a tough time out there. It's the way this goes." And that's the way it ended up. And I'm thinking about where I am today, as an orthopedic surgeon, as a father, all the people that I've been able to help. And I just think about that day, and had I said something maybe a little bit different, maybe none of this happens today. So your education, the things you do, don't make you immune. And just because you accomplish something and you accomplish your personal goals doesn't mean that we shouldn't be thinking about the larger community and dealing with some of these problems. And that's why I'm here today. Clarence Fluker reached out to me last week or a week and a half ago and said, "Hey, you came and lectured to our folks before. What do you think about what's going on?" And I told him, and I said, "Listen, let's get everybody together and let's talk about this, because this is a problem." Another story I competed in judo from the age of 9. I played football, judo, played some soccer for a while, and I played lacrosse. I ended up getting a scholarship to play lacrosse in college, and I played all 4 years. And when I was done, I went back to judo, and that's something that I continue to do. I continue to teach and work out. I don't compete anymore. But at one point, I had won a national championship, and I was competing in the light heavyweight division. And a buddy of mine, a really good friend of mine, was competing in the heavyweight division. And one of the nicest people I've ever met. Kind, humble, courteous. When he got on the mat, he was a beast. But when he came off the mat, he was just a wonderful person. And I went to a couple tournaments after that particular tournament, and I didn't see him. And I was asking around, and another one of my friends just put his head down, and he goes, "Oh, you didn't hear? He went to jail." And so what had happened was he had been in a restaurant, and 3 men accosted him. He defended himself, disarmed them, and one of the men got hurt, but all of them were fine. And my friend went to jail. And he went to jail because he was a black belt in judo. And that's what was cited, was that he should have had more control. Well, how is it that a black man with a black belt in judo has to have more control, but our police force doesn't have to be held to the same standard? And I think this is some of the stuff that we have to collectively figure out how to address. And I don't think it means getting rid of the police. I mean, being in judo, I have come across some of the best, humblest, wonderful people in law enforcement. Fantastic. But we've got to do something about this system. So hopefully today we can spur some of this discussion and talk about your experiences. I would love to hear at some point from each of you if you've had any experiences like this, because I think it's important to share it. Silently enduring this type of behavior, these violations, it shouldn't be tolerated. And I think this is something we need to work to improve. We also need to talk about educational reform, improving the schools, awareness of opportunities, and creating networks. I'm grateful that my parents put me in the best schools possible. My dad is West African. He was one of 7 students in 1961 that scored higher than every single French student in the French country. They took the French equivalent exam. They were a French colony. And the French were so bewildered by the fact that these Africans had outscored them on the test that they sent a delegation to see what was going on. And when they got there, they were blown away by the knowledge, not just the 7, but the collective knowledge of these hardworking Africans who wanted a better life. And so my dad in 1962 was one of 7 people selected to come to either the United States or Europe as part of the Kennedy administration initiative to come across to the United States. And he's been here ever since. He became a lawyer. He was a diplomat for a while. And so, while in the United States, as a black man, you are expected to excel in sports. It's just sort of an underlying thing that's just what you're expected to do. But I was expected to get A's. And I could mess around with sports, but if I didn't get A's, I got a whooping when I got home. That's just the way it was. And I grew up with that, and I'm grateful for that to this day, because I was able to focus, and we'll talk a little bit more about that later. But it's critical to know the opportunities. If you don't know the opportunities are out there, if you don't develop skills at an early age on how to negotiate the academic environment, you lose hope. And when you lose hope, despair comes. And when despair comes, you start doing things that are desperate. And things that are desperate include violating the law, taking drugs, harming yourself, not eating properly. All these things happen in our communities, and they're things that we need to continue to work to fight against. Voting rights is another really important thing. We used to be considered 2/3 of an individual. We weren't a whole man as a black person. This is something that people died for, and yet I hear some of my friends and colleagues even say, "Oh, I'm not real political. I'm not going to vote." Man, that's crazy. That is crazy. And that there are people on the far right that are fighting to take those rights away from us. I don't know if you read the news a couple of days ago in Georgia at the local election in the black community. There were lines all day into the night because there weren't enough ballots. There weren't enough people serving the ballot booths in the black communities. And so some of these votes fall through the cracks. Our folks don't get to vote. This is criminal. I don't understand why it's tolerated. And this morning, LeBron James came out and announced that he formed a coalition of players, civic leaders, entertainers, and said it's time to reverse this trend. It's time to fight against this. And he's pouring his effort into getting the voting rights thing correct. So really exciting stuff there. And I think it's another really important thing. You guys have to vote. You have to speak your voice. If you don't speak your voice, somebody else will speak it for you, and it may not be the voice that you want to hear. And healthcare is where I'm where I've kind of cut my teeth. I work at MedStar, $6 billion healthcare system, and as director of sports medicine, we have a robust research program that we've been working on, and are submitting a grant to the NIH to look at surgical disparities in orthopedic procedures. Looking at social determinants of health and how they can be put into the EMRs. The EMRs do a great job of recording all kinds of data, but what they don't determine is who's in what socioeconomic class, who's black or white. And the problem is, if we don't detect where the disparities are, we can't fix them. There's consistent evidence that African Americans, when compared to Americans, show higher all-cause mortality rates, poorer access to care, inferior access to surgical care, and those who do get surgery have worse results statistically. This is unconscionable. It's not something that we should tolerate. You have Prince George's County, is the wealthiest black county in the country, and yet we have a disparity between the outcomes in patients in those regions with their compared white regions around the DMV. And it's just not something that we should allow to continue in the face of all the resources that are available to us. There's higher mortality for high prevalence conditions like essential hypertension, diabetes, stroke, and kidney disease. And so when we look at racial disparity in healthcare, what are the strategies to combat this? As I said earlier, you have to first detect them. If you don't have a mechanism to detect the disparity, you can't fix the problem. Once you've detected the disparity, then you have to figure out the determinants. What caused it? What caused that disparity? And then the third phase of that is to eliminate the disparity. So in our current endeavor, we're looking at detecting right now. We're building building into our electronic medical record a way of systematically detecting certain social determinants of health that have been outlined in the general population. And that's step one. And then once we determine what's going on, then we can eliminate the problem. Now, another element of eliminating racial disparity is prevention. It's been shown that early childhood intervention in education is critical. And you may say, okay, well, I can understand how that might help them get a better job, but how does that link to healthcare? Well, there were studies. There was a study in Michigan in the 1960s and a study in North Carolina in the 1970s where they had a targeted intervention in healthcare for young children. And they randomized the children, black children in poor neighborhoods, to either have nothing done and just go to the regular school, or create social structure, create teachers help on a regular basis coming into the house to teach them skills, learning skills. And what they found was when those kids became adults, you can guess, the kids that had the targeted interventions had less crime, committed less crimes. They had higher education and better paying jobs, and they had better health markers for risk of health disease, less obesity, lower BMI, better cardiac risk profiles. And this was really compelling. The problem is that when we tried to apply those on a federal level, some of that got lost. And part of the reason that we speculate that got lost is just kind of like a franchise. You have the name McDonald's, but each store is a little bit different and different people are running it. These targeted programs in the 60s and 70s, the researchers were passionate about getting to an end result. And so we need to find some kind of happy medium where we get things done on a large scale, but we continue to infuse the passion that you see in the smaller targeted studies. And this is reflected in the ACA paradox. The Affordable Care Act God bless President Obama for trying to eliminate some of these disparities. They created accountable care organizations, or ACOs, which were designed to make healthcare more efficient and improve delivery for everyone involved in a particular healthcare insurance entity. Unfortunately, what they found was, paradoxically, that the white folks mentality. And this is really, it's really difficult. And what it shows is that we're probably not doing a great job of identifying, as I said before, the social determinants of health to be able to parse out the folks that really need the biggest delta or the biggest change. So more work to be done, something that we're proud to be working on at MedStar, and something that all of you who are interested in healthcare, there's plenty of work to do. So when we talk about all these things today, it's kind of daunting. How do I succeed? Poor education in the community, racial disparities, systemic racism in the police department and the educational system. So I just thought I'd talk a little bit about things that I've done along the way. And I've been blessed. Both parents are at home. Unfortunately, my mom passed away 2 years ago, but was a critical factor in my life. And she was a teacher. She taught at a private school when we couldn't afford to go to private school. And so they waived our tuition. And I was able to go to school with kids who made a lot more than we did. And I got to see people day to day who are now leaders in the community and leaders in their professions. And it helped me understand that I can do this too. So I'm grateful to my parents for the education that they provided. When I think about how everything started, you know, I always said yes. When opportunities came up, you know, sure, I'd think about whether I could do it or not, but at a certain point in my life, I had enough confidence where I said, you know, anything I put my mind to, I can do, and I'm going to stop focusing about what other people tell me to do. I'm going to do what I want to do. And I remember when the Washington Nationals job came up, there were a few people who were up for the job that had several years more experience. I was only 34 right out of my fellowship. It would have made me the youngest head team doctor in all of MLB, and one of 2 Black doctors in MLB at the time. I ended up getting the job. And this was despite people telling me, man, you're not going to get that job. There's no way you can get that job. You haven't had any experience. I don't even know if you know how to operate yet. You know, and I didn't listen to any of that stuff because I knew I could do it. I believed I could do it. Every step along the way, when I'd set a goal, I achieved it. I forced myself to challenge myself and say, you know what? I'm not listening to what other people say. And that comes to the second part of this slide, which is close out the noise. If I had a penny for every person that told me I couldn't do something, I could retire today. There's no question about it. So many people, Black, white, Chinese, whatever, came up to me at different points in my development and said, you know, you can't do that. That's not going to work. How are you going to be a team doctor? How are you going to become an orthopedic surgeon? Medical school. You know how hard it is to get into medical school? You know, these are things that I heard. I still remember a professor, I had a B in a class. And I went to his class in college and I said, sir, I'd like for you to explain to me what's going on in the class because I'd like to get a better grade. And he looked at me, he knew I was an athlete, and he started laughing. He's like, what are you worried about? You're doing fine. And I said, well, you know, in lacrosse or in football or in judo, there is no fine. There's win or lose. And to me, win is an A. And he laughed and he goes, oh man, you know, you're so uptight. You don't worry about that. You're doing fine. And then he realized I was serious. And I just sat there until he started helping me with the course. And I ended up getting an A. And I remember, he's an older white gentleman. I remember after that experience, in the class, he would bring me up as an example and ask me to explain things to the class. And I could this is not a man who I believe was was inherently racist, but I believe the system had given him so many examples of Black faces that didn't care, weren't interested, wasn't possible, that his response was laughter. He was like, you should be happy. Go tell your parents, throw a party. But for me, a B meant I was applying to medical school in one of the most competitive environments. I think right now the admission rate to medical school, and you guys could tell me, Kim and company, it's about 2.8%. I think admissions to Harvard undergrad or Stanford is around 4 or 5%. It's hard to get into medical school. And people get straight A's and don't get into medical school. When I was in medical school, as a fourth-year student, I was on the admissions committee, and I saw some of these people that didn't get in. And so from my perspective, again, it's important to close out the noise. When that professor's laughing, I let him laugh, but I knew I was there for a purpose, and I wasn't going to leave until he helped me achieve my goal. And we actually became friends, and he became sort of a mentor in a way. So again, that's the third part of this slide, is actively seek mentors. I had people that told me that I couldn't do something or said they wouldn't help. And I didn't go into my room and cry and say, oh, they're not gonna help me. You know what I did? I went and I found somebody else. And the interesting thing is, I have mentors that are Black, that are white, that are female, that are male, that are gay, whatever. All these people along the way have mentored me, and I'm grateful to these people that have mentored me. And I just think of it as, now there's a Black face in the pantheon of doctors who take care of professional athletes. There's not many of us. I think there's 5 or 6 of us, orthopedic surgeons taking care of NBA teams. I think there's 1 or 2 taking care of NHL teams. There's about 5 or 6 taking care of Major League Baseball teams right now. There's just not many of us at all. And these people help me. And so I think when we talk about Black Lives Matter and we talk about all these things, this is a humanity issue. This is the reason Black Lives Matter, is because humanity matters. The reason, there was a great slide that said, we know all lives matter, but it doesn't mean that Black lives don't matter. And right now, that's the focus. But when all this is said and done, we're trying to talk about how to create a better humanity. And I think that's what you guys should be thinking about. I think it's important to understand that there are going to be voices on all sides that are trying to pull you down. And I'm proud of my skin color, and I'm proud of the people that I have that have helped me along the way. My mom, believe it or not, she's white. She was white. My dad was Black. I have white people that love me. I have Black people that love me. But in this society, I'm considered Black. And you know what? I embrace that. It is what it is. And when people get to know me, then they find out more about me. But I think the reality is, you've got to focus on, what do you want to do with your life? Just say yes, know your strengths and your weaknesses, close out the noise. And while you're climbing, figure out who can help you get to the top. So, it's a very difficult time right now on a number of levels. The pandemic, racial issues, and who knows what's going to be next. But I think that's the job for all of you, is to figure out where you fit in and how you can help. And there's a lot of ways that you can do that. So I think that's all I've got to talk about right now. I'd love to hear questions and open the floor for conversation.
Thank you so much for that. We did have a few questions come in during your presentation, so we're going to start with those. And I encourage, those that didn't get an opportunity to type out your questions or thoughts, please do so now. We want to hear, what you're thinking, and this is your opportunity to get advice from Dr. Wiemi. So the first question that came in was related to defunding the police. So this question was, would it not cause cops to become more frustrated due to defunding and potentially hurt the community, especially the Black community?
Yeah, that's a great question. And I think I tried to address that earlier, which is, that's why I had a big question mark next to defunding the police. I think we need to find ways to hold people accountable and lift up and support the law enforcement that want to do their job. As I said, I've come across a lot of wonderful law enforcement officers, Black, white, Asian, whatever race, from Kazakhstan. The bottom line is these people have need to be uplifted. And so I get concerned when I hear things like defund. You know, what does that mean? What's your plan for doing that? It has to be nuanced. And I think that what we really should be talking about is let's hold these people accountable. Let's hold the people accountable that are doing these horrible things. That's really what I believe. So that's a great question.
So the next question that I see came in is, how do you acquire a mentor? You just spoke about, you know, the importance of mentorship and how that can really steer you in the right direction. And this student wants to know, how do you find a mentor? How do you go about asking someone to be your mentor? Also, how do you keep the connection strong after a period of time?
That's a great question. Another great question. So I'll give you an example to answer that question. When I was in college, I wanted to go to med school, and during my junior year, the summer of my junior year, I decided I wanted to do a research project. One of the things that my advisor told me is that I needed to have some research or show an interest in research if I wanted to get into medicine. It wasn't just about good grades. So I went through I went to Washington and Lee. I went through the alumni handbook. I lived in Northern Virginia at the time. And I went through the alumni handbook looking for doctors in the Northern Virginia region. And I found a doctor at Georgetown, and I called him and I said, hey, I'm interested in medicine. He didn't know who I was, white doctor. And he said, well, you know, I don't have anything that I'm doing research on, but let me introduce you to this woman, Mary Ann Tarkington. Dr. Tarkington is a urologist in DC. And I met with her and she said, hey, I have a research project I'm working on. And a week later, I was in her lab. I spent the summer working in her lab. That question is, take some initiative. If you have an idea of something you're interested in, think about the resources. Nobody told me that I should go through the alumni handbook, but I figured that the alumni might be interested in helping some prospective graduate, and then sure enough, they were. And that was the beginning of my medical career. And they wrote me letters of recommendation to get into medical school. I ended up going to the Medical College of Virginia, and here I am now. So yeah, it's a great question.
So the next one that I see is, what are some ways to reduce disparities for the Black community besides education at an early age?
Yes, that's a fantastic question. So there's some other things that have been brought up. Targeted skill building in communities. So community planning, urban planning, and community outreach. So skill building in terms of improving, for example, shopping habits. You know, we go to stores and, you know, I remember in college, I could get a Big Mac for 99 cents or a Whopper for 99 cents, but it cost $5 to get a salad. So creating programs where you could get a discount on the healthier food is an example. Another example of things that help out with health and with disparities is that communities that have high concentrations or high density of alcohol stores have higher rates of violent crime, alcohol abuse, substance abuse, and poorer health. It's a no-brainer. Take them out. You know, so these are some things that can be done. There's lots of things that can be done, and I would encourage you to read about health disparities. You can go online now. I mean, it used to be you had to go to the library and talk to the librarian, and it's just all day thing. Now you can just go click, 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 click. Look up social determinants of health. Look up healthcare disparities, and I'll actually send a couple of articles to Kim after the talk so that you guys can read and get some background on it. Thank you. Good question.
So our next question is, in regards to racism in the healthcare field, what steps do you think the upcoming generation of healthcare professionals must take to address the issue?
That's a fantastic question. First thing you have to do is be excellent. That's the first thing to do, is be excellent. I cannot emphasize that enough. Everyone wants to help, but it's hard to help when you have not maximized your potential. When you maximize your potential, people listen. People, they want to see leaders. And so I challenge you to go out and be the best that you possibly can be. The reason that LeBron James draws so much attention and is so effective at getting things across that the average person can't get across is because he's visible, he's respected by black and white alike, and realizes that he can move people in ways that maybe somebody with the same type of face can't, that doesn't have the accolades that he has. So the first and foremost thing I would say is to be excellent. And then after you've become excellent, you've achieved your goals, understand that achieving your goals in a vacuum only goes so far, and that really trying to understand what else is out there that could adversely affect you is important. And as an example, I've done a lot of things in my life I've set out to do. Um, Things have gone quite well. I've been very privileged and blessed, but I still encounter racism on the job. I encounter people who don't want me to do certain things, and I still have these battles. They don't stop. So, it's not enough to be excellent, but you also have to try to figure out what mechanisms are in play that you can use to fix these problems. So I got the job. I finished med school. I'm proud of myself. Okay. I start moving up. Now I encounter racism. Man, this is crazy. I'm encountering this. I thought I'd beaten through those barriers. So what do I do next? We go and do research on social determinants of health and disparities in health so that we can improve the environment for our patients, for healthcare providers, et cetera. So I think that's the way I approach things in my life. Each person has their own way, but I think the first step is being excellent.
So our next question is related to funding opportunities for medical school. This question is, what advice would you give Black pre-med students or just pre-meds in general about who are interested in seeking full scholarship opportunities such as you had?
Yeah, that's a tough one. Those are, I think there's resources online that you can go to. There's so many different scholarships out there. My son is now in college, and we went through the process to look for scholarships, and there's lots of different things you can find out there that are based on where you live, that are based on if you play an instrument or you've done service. And so I would encourage you to contact your high school or college counselors about scholarship opportunities. For me, mine was for lacrosse, and Washington and Lee was not my first choice school, but ended up being a tremendous place for me because I learned. It challenged me in ways that I never thought I'd be challenged. I mean, it was funny. I got there, General Lee's buried on the campus, got Confederate flags hanging out the window, and I see a kid driving a BMW that says David Duke for president. I said, where am I right now? How the heck did I end up here? And I think this goes back to closing out the noise that we talked about before. I knew there was an opportunity. I knew that if I had that stamp behind my name, that it was going to afford me opportunity. And I identified good people that helped me climb and reach my goals. So I think you want to, as far as scholarships are concerned, again, it goes back to being excellent. Do the best you possibly can, and then go to your counselors and see if there's resources online that you can tap into to try to identify funding sources.
So since some students had some questions about funding opportunities, I feel like it would be a missed opportunity for me to not to mention some of the AAMC resources as well. out our BURST program as well. That gives you a lot of information about how to finance your medical education. And at the end of our Q&A, I'm going to be sharing a list of our different resources that can provide you some guidance in that area. So our next question here is, have you ever been passed up for a position or opportunity while a colleague that had the same credentials, experience as you received the position and you knew it's because of your skin color? And how did you handle it? If you haven't, what advice would you give someone who may experience this?
I will tell you that I've had people that I've been passed up by that have less credentials than I have. So, and the way I deal with it is anger. It's talking to my wife, talking to my kids. It's talking to my family. It's going for a run. It's reading a book. It's trying to find constructive ways of channeling that anger. It's working harder. It's never quitting. It's one of the things I tell my kids all the time is never, ever quit. If failure, I think Michael Jordan had that quote where like I missed, 6,000 game-winning shots. I lost 350 games, and that's what made me great. I mean, I think the point is you're going to fail. People are going to pass you up. There's going to be all kinds of reasons. Maybe they wanted a woman that time, and maybe you'll get the job because they want a black person. Who knows? But the point is, you focus on your goal. You close out the noise. If some you get when to speak up, when to sort of breast your cards and wait for the right time. That's something that I don't think anyone can really tell you. It's something that you'll learn on your own. And I've messed up. There are times when I should have spoken up, and then there are times when I spoke up and I was the angry black man. You're never gonna be perfect. But I think you got to be true to yourself and evaluate each instance and try to be objective about it. And when you see an opportunity to stand up for yourself, you do it. Kim, while you're looking for that other question, another story I had was that there's this thing called Kids Post in the Washington Post. And in 2014, they interviewed me for Kids Post, and they wanted to tell kids about what an orthopedic surgeon does for the Washington Nationals, for a baseball team. And they interviewed a beat reporter, and they interviewed me, and then they interviewed, I can't remember who the other person was. So they drew a cartoon after they did it. It was a really nice article, and it talked about what I did for kids. But except the reporter was black and I was white. And so we got the hard thing. It was like, hey, wait a minute. I'm a black doctor, and yet the image of me is white. How did that happen? So my sister called in. She was pissed off, and she yelled at the editor, and she was really angry about it. And what they ended up doing was, if you go and you click on it, they don't have anything. They just have the story, and they don't have the picture. So instead of correcting the problem, they just erased it. And you talk about, maybe I'm being cynical, but I think there was an opportunity to show some young black kids, oh man, he's a doctor, and he's a doctor of color, and it's another past opportunity, and it's another thing that we sort of silently endure. Whether it's a police beating, whether it's some subtle systemic racial bias, there are all these things there that are, and I try not to ignore them. I try to be aware of them and remind myself of them without taking away from the positive energy that I try to impart to my kids, that I try to deliver when I take care of my patients. It's just a constant battle. So I'm curious to know if there's anybody out there, Kim, that has a similar story or a little short thing that they can relay and in relation to a question about racism that they've experienced. Might be nice to hear.
I will look for those responses that come in directly related to different experiences that people may have had with racism. I've identified another question here related to social determinants of health and electronic medical records that you were discussing earlier. So this question is in regards to adding to social determinants of health information about EMR, how do we ensure it does not end up as another level of implicit bias and harms the quality of care for Black people and minorities? We know we see negative effects of prejudice and implicit bias in maternal health, addiction management, and other areas. And I'm worried that healthcare community has a lot of structural internalized beliefs that would serve as another barrier to care.
Well, again, I mean, we saw this with the example that I brought about the ACA and how it was intended to help people get care, but there were examples of how disparities increased despite trying to rectify some of those disparities. And so I think the answer to your question is trying to figure out, going back to basics. First, we have to detect them, and then we have to figure out the determinants, and then we have to work on strategies to eliminate. And I think that the only way to answer that is by having people that are passionate and care involved in the process. If you turn it over to somebody who wants to check the box and say, hey, I'm doing research on racial disparities, I'm racially competent, check my box, and then go back to your life where you implicitly discriminate, that doesn't do any good. But I think having people like you who are concerned and others, that's what I hate about Zoom is you can't see faces, but have people that are concerned about the process and want to affect change, stay on top of it so that it doesn't fall through the cracks and you're not just checking a box.
So I've had a few questions come in regarding imposter syndrome. So this student said that I'm a first generation Hispanic student. I always feel as if this field, regardless of how well I've done in my studies, isn't for me. I want to become a doctor. I want to change how people are represented in the field. So how do I get over that barrier and doubt that imposter syndrome seems to always have with me?
Well, I think if you talk to any champion, anyone who's won a sports contest, anyone who's become excellent, they have had doubt. And so doubt is a normal part of the process of success. And if anything, when you feel doubt, it's a sign you're challenging yourself and you're heading in the right direction. So don't let that doubt deter you. Embrace it and accept it and have strategies to deal with it. I doubted that I was going to be able to get the words out of my mouth today, but somehow it happened because I'm used to it now. I'm used to speaking. And so I know that my heart rate's going to go up when I talk. I know that I'm going to have thoughts in my head that, hey, maybe I'll forget my words. But you just develop strategies. And interesting, it's like a snowball. As you work on embracing that doubt as part of what's normal, what's going to happen, and you fight through it and struggle to get to the next step, you're going to make progress. And I think that's what a lot of people think, is that people that are in medical school are brilliant, or that that got into Harvard are brilliant. A lot of those people got in because they busted their butt and they believe in themselves. And that's really, really important. I think it's important to have the skills at an early age. Those things are things you can't change. But what you can change is you can have a work ethic that says, yeah, you know what, this person's ahead of me, but at the end of that, I'm going to be ahead of them. And I think I can't emphasize that enough. You have to believe in yourself. You have to understand that you're going to feel doubt, and that's part of it. It doesn't mean you're any less of a person and that you're any dumber, or any smarter or dumber than anybody else. It's normal. Everybody does it. I think they said Abraham Lincoln lost 16 tries before he became president. So just remember that. And I think, if you feel doubt, it means you're challenging yourself and you're on the right track. Keep up the good work.
So our next question comes from a pre-health advisor. She's interested in learning what advice you might have to support our Black students who are applying to medical school this cycle, especially if they are afraid to talk about race, but it's really important to their why.
don't be afraid to talk about race. Or I should say, let that fear come in, just like the previous question. I have these doubts. Let those doubts come in. Let those fears come in. But at the end of the day, you have to speak your mind. You have to tell people what you are all about. And it's not to have a wandering conversation about race that doesn't have direction. But if race is directly related to a point you're trying to make, do not beat around the bush. And I guarantee you, you will command the respect of the people in the room.
So earlier you asked for some of the participants to share their experiences with racism. And Jasmine has shared her story here. So,
oh, wow.
My name is Jasmine. I experienced racism when I moved to Georgia from California when I was in 8th grade. My English teacher profiled me and told me I might be more comfortable in ESOL. When she heard me say my name and tell her I thought I was in the correct course, she expressed a surprised expression and told me to have a seat. She thought I didn't know how to speak English because of how I looked. I dealt with this situation by speaking to my mom about the incident and just moving forward, knowing that some people might have maybe naive to certain cultures and races.
Wow. Yeah, and those are things that I'm sure that there's probably a lot of other people on the call right now who have experienced something like that. And the unfortunate thing is that teacher is probably still teaching right now. And unless we speak up and help educate that person about what's going on, they're not gonna know. It's important to tell those stories. It's important to be able to tell stories, and I really appreciate, Jasmine, you letting us know that, because that's something that that at an 8th grade is such an impressionable period of your life. And fortunately, you had the wherewithal to go and tell your mom. There's some people whose parents don't care, and they just sort of absorb it, and they look at that teacher as the closest thing to a father or a mother figure for them, and they just say, well, it must be right. So hopefully you've developed techniques to work through that, and I would continue to not let those kind of things happen. And the other thing is, if you hear about other people to whom that happens, help them and tell your story and tell them how you dealt with it. That's great. Thank you.
So our next question is, what is something you wish you knew or would have done differently as you entered the medical profession?
I wish I knew it was going to be on that surgery test. It's interesting. I don't dwell too much on what I didn't have or didn't know. I find that sometimes stumbling along the way is how you learn. I tell my residents and fellows when they're training with me, when they go into a room and they evaluate a patient, I want them to come up with, I want them to formulate a diagnosis, as opposed to they go in and they evaluate the patient and they listen to me tell them what's right. Because the way I learned was falling on my face. And I tell them that if you come out of the room and you've said the wrong diagnosis to me, you're going to feel bad about it. And you're going to go home that night and you're going to read about it. If you get the right diagnosis, it's going to reinforce your thought process and you're going to be happy about it. Either way, you win. And so I think when I think of things that I didn't know along the way, there's nothing I really wish that I had. I just enjoy the process. And, when I encounter something that I mess up on, I try to make it right the next time. I always prided myself on the fact that I'll make a mistake the first time because I'm ignorant. The second time I'm not ignorant, I better not make that mistake again. And that's something that I've always tried to do in my career, and it's been helpful for me.
All right, we're getting close on time here, but I think we're going to close out with this question. So what are some ways that you've worked to support your mental health through your journey, through medical school and now in your career? And I think this topic of mental health is, particularly important now with everything that's going on related to fears with COVID and everything that's going on in the world regarding, injustices and race. So what are some different ways and what's some advice that you have for our students in terms of, really focusing on their mental health?
So I told you a little, that's an awesome question. What a great way to finish this. When I was in college, I told you the college I went to and some of the images that I saw early on, and they were very shocking. I grew up in New Jersey in a town that was pretty even black and white, affluent blacks, affluent whites, poor whites, everybody sort of mixed together. And it was a relatively unique place. In fact, Chris Rock had he had a comedy skit when I was in college, and he said, I just was walking by the television, and he says, what's the best place in the world for a mixed race kid to grow up? And he said, Montclair, New Jersey. And my eyes were, I was like, that's where I'm from. This is cool. And then the next thing out of his mouth was like, what's the worst place for a mixed race kid to grow up? And he said, everywhere else. And I had to laugh because it was a special environment. So I went from there to Washington and Lee, and it was a tremendous shock to my system. And I had some elements I was spoiled, entitled in some ways, and things that had to come out of my system. But man, that was a tough place to learn. And I went through a period of depression when I was there and didn't like it very much. And I latched on to my parents. I got a counselor to talk to. I talked to a psychologist. Playing sports helped. I buried myself in workouts. And I just tried to break things down really simply. What do I want to do? What do I not want to do? Try to hold myself accountable for if I didn't do my assignment. Don't blame it on anybody else. Don't say the teacher was racist or whatever like that. Just do your work. And I began this stepwise process of recovery that has served me for the rest of my life. It doesn't mean that I don't have ups and downs. I think we all do. But don't be afraid to reach out to your support. I mean, it goes back to seeking out mentors. Find people that are positive, whether it's in your church, whether it's in your school, whether it's at work, people that you can be friends with that uplift you and that force you to be your better self. Don't be afraid to get help. There's lots of resources out there. It's nothing to be embarrassed about. If you fall and you're depressed, you're down, you're thinking badly about yourself, find someone that can help you create tips. You're not a bad person because you went and you talked to somebody. So I think those are things that you can do. And certainly the thing you don't want to do is bury your head. Pick yourself up, believe in yourself, understand everyone. A lot of people are feeling the same way you do, and keep fighting. So great question.
Thank you. Well, I want to thank you for your time and your expertise, and for sharing all of your wisdom with us today. It was an excellent conversation. I got a lot from it. I'm sure our participants got a lot from it. And I want to thank you all who joined us today for coming to hear more about this very important topic. I want you guys to continue these conversations beyond this webinar. Continue those conversations with your family, your friends, your teachers, your community members, because we have to keep this conversation going, so we can see the changes that we want to see here. I also want to encourage you to continue to prepare yourselves to become the future doctors that we need and the future healthcare professionals that we need. And one of the ways that you can do that is checking out our resources here at AAMC. I mentioned one of them earlier when we had the question about financing your medical education. These are a list of our other resources that would help you along your journey. I know many of you have taken advantage of one of the resources listed here because we invited a lot of our SHPEP alumni. But for those of you that may be entering your first year of college or maybe a sophomore, then definitely look into this free summer program. You're going to get excellent experience. We talked about mentorship earlier. This is a great way to get that mentorship, but also connect with peers who look like you, who are interested in going into the health profession. And then if you just want resources about how to, what goes into the MCAT, how exactly do you get through the AMCAS application, learning about the stories and the journeys of others who've experienced this, check out Aspiring Docs, as well as subscribe to our Pre-Med Navigator, so you can learn more about the different resources that we have. And you can get information about all of this at AMC/students. So thank you all for joining us today, and I hope you guys stay well, and we'll see you next time.
Thanks a lot.